Good morning, everyone, and welcome to the second annual Global Summit, Global Kidney Innovations, Expanding Patient Choice and Outcomes. My name is Dr. Barbara Bass, and I serve as the Vice President of Health Affairs, Dean of the George Washington School of Medicine and Health Sciences, and the CEO of the GW Medical Faculty Associates here in Washington, D.C. We are honored to co-host this event for the second year with the American Association of Kidney Patients, the largest kidney patient organization in the United States. AAKP has worked tirelessly with great success in shaping public policy to ensure the patient's voice is present and heard in nearly every national debate and decision on kidney disease policy over the last 50 years. This year's event, needless to say, looks quite different from last year's highly successful gathering. Like all other major groups in the world these days, we are now online, a change that I know will not diminish the energy of those gathered for this important conference or the impact of the proceedings from this meeting to improve the care for patients living with kidney disease. We have had an overwhelming response from participants, and we welcome everyone who has joined us for this important conversation. I extend a special thanks to AAKP President, Mr. Richard Knight. As many of you are aware, he is a kidney transplant recipient and veteran U.S. congressional staffer. His dedication to advancing kidney disease research, education, and advocacy is unsurpassed. I would also like to thank our returning Global Summit co-chairs, GW Professor of Medicine and Director of the GW Division of Renal Disease and Hypertension, Dr. Dominic, and AAKP Chair of Policy and Global Affairs, Mr. Paul Conway. Mr. Conway is also a kidney transplant recipient and has been a most influential leader and advocate for kidney patients on Capitol Hill for many years, serving under 3 presidents. This summit brings together an international community of nephrologists and other medical specialists, scientists, and kidney patients who share the common goal of saving and restoring kidneys, and in so doing, saving lives and improving health for patients with renal disorders. At GW School of Medicine and Health Sciences, one of the oldest medical schools in the United States, we are home to multiple highly ranked programs in the health and biomedical sciences, nephrology being one of those starring programs. We are well known for training outstanding clinicians and allied health professionals, as well as for developing the latest advances in prevention, treatment, and innovative care. We are driven by our mission to improve the lives of the patients we serve. Regrettably, here in Washington, D.C., we live in a city that has staggering rates of kidney disease. Our patients depend on our physicians, nurses, advanced practice providers, and allied health workers from all disciplines of medicine and surgery for their care and guidance. The challenges of providing this care, and indeed of moving research to improve this care, has proven to be especially challenging over these last 6 months as we have come to grips with battling a global pandemic caused by the novel and deadly COVID-19 virus. The inaugural Global Summit last year was live streamed in over 50 countries and viewed by an international audience of researchers, medical professionals, government officials, and patients. Last year's audience learned about cutting-edge breakthroughs in genetic research and kidney precision medicine, artificial implantable and wearable kidneys, new methods for enhancing life-saving organ donations. We learned about telemedicine and the next generation of diagnostics and biologics to help detect and slow the progression of kidney disease and kidney failure. A great portfolio of evolving clinical care and science in kidney disease. At that first summit, an important theme emerged that the global community of medical experts, innovation drivers, and kidney patients does hold the keys to saving millions of human lives. But clearly, there is still a great deal of work for this global community to do together. This year, the Global Summit again includes presentations on the next phase of innovative breakthroughs in kidney disease, again presented by a diverse international faculty. However, this year, the agenda takes sharp focus as well on the evolving body of knowledge of the COVID-19 virus and its impact on patients living with kidney disease. These topics could not be more timely and relevant. I'm sure these proceedings will be helpful to medical professionals and patients throughout the world, and I look forward to learning about the outcomes of these important presentations and discussions in your daily practices. Once again, I thank you for joining our second annual Global Summit on Kidney Disease. We are grateful you are with us today and tomorrow. And once again, I congratulate the organizers for gathering such a distinguished group to address these most important topics. I wish you all a most successful conference and good health. Be well.
Good morning, everyone. Thank you, Dean Bass, for the kind introduction. It is truly an honor for me, both as a kidney patient and president of AAKP, to speak before old and new friends in the fight against kidney disease at our second annual Global Summit on Global Innovations in Patient-Centered Kidney Care. AAKP is here today with our co-host, the GW School of Medicine and Health Sciences, to talk about kidney patients and innovations that will improve the patients' lives. This year's summit focuses on the impact of COVID-19 on kidneys and kidney patients, as well as key innovations in kidney care. We assembled global leaders to educate and inform all listening and watching today on essential innovations in patient-centered care. My colleagues who are participating today, board members, ambassadors, and patients, want to thank the hard work of our staff, led by the outstanding executive, Diana Kleins, in expanding our international reach by executing this event together with GW. I also need to acknowledge the co-chairs of the summit, Paul Conway and Dr. Dominic Raj. Last year, I noted that most patients came to GW's hospital seeking treatment. But it's worth repeating that Paul and Dr. Raj ended up conceptualizing this fine event during a medical visit, of course, after receiving medical treatment. I talk with my nephrologist about soccer, and things, quite frankly, have simply never been the same between AAKP or GW University. The important point here is the vision that both of them exhibited. AAKP's mission is to educate and advocate. Today's Global Summit is an alliance focused on kidney disease education and the advancement of care choices and options for patients. It is in the spirit and hope for a better future that we welcome the medical professionals, patient advocates, academics, and researchers, government decision makers, industry experts, and entrepreneurs who will enlighten us about innovation in all phases of issues faced by kidney patients along the kidney continuum. During these unprecedented times, as kidney patients, we understand the difficulties professionals and kidney patients across the nation, and in fact, the globe, are enduring. We live in a world of change, and healthcare change is brought about by industry driving forces. Technology and regulations are well-known driving forces. But I know that patients are a key driving force in this industry as well. The Global Summit is an example of patient engagement in action and patients as a driving force in motion. I want to thank our sponsors, Amgen and CareDx, our silver sponsors, Natera, Eurofins, and Outset, patron sponsors, and Retrofin, a supporting sponsor. We appreciate their support of this second annual Global Summit. Now, I would like to introduce Dr. Dominic Raj. He is the Global Summit co-chair and the director of the Division of Renal Diseases and Hypertension at GW University. I should also add that he is quite the visionary. Let's welcome Dr. Raj.
Good morning. I'm Dominic Raj. I'm the Chief of Nephrology at the George Washington University School of Medicine. I'm the co-chair for the Global Nephrology Summit. I'm going to tell you why we need a second Global Nephrology Summit in this talk. The concept of this conference is very simple. bring together providers, scientists, policymakers, industry, and patients to set priorities, formulate solutions, and improve outcomes through transformative discoveries and global policies. The 2019 inaugural Global Nephrology Summit focused on innovations in patient-centered kidney care. It was a tremendous success by all measures. There were 35 presentations delivered by experts from 23 institutions from 5 different countries, attended by more than 200 participants and watched online by thousands of participants from 52 countries. Inspired by the success of the inaugural summit and driven by demand from the nephrology community, we conceived the second summit, which is the central theme of expanding patient choices and outcomes. The COVID-19 pandemic came unannounced and our priorities changed. We seriously considered canceling the summit. But we recalled, in this world, you are either growing or you're dying. So we decided to get in motion and use this opportunity to address the relevance of COVID-19 to the kidney community. Kidney patients are susceptible to COVID-19 because of the need for thrice weekly in-center dialysis and immunosuppressed state of transplant patients. Approximately 20 to 40% of COVID patients develop acute kidney injury. Many studies have reported that there is a dose-dependent relationship between severity of acute kidney injury and death among COVID-infected patients. Acute kidney injury is a common, often under-recognized disorder, which is associated with high risk for mortality and also development of chronic kidney disease. Unfortunately, there is no clear preventive or treatment strategies available at present. There is a global epidemic of CKD, largely driven by aging populations and increasing prevalence of diabetes. There are about 850 million people with CKD worldwide. It is responsible for at least 2.4 million deaths per year. The cost of dialysis and transplantation consume about 2 to 3% of the annual healthcare budget in the US alone. The global burden of CKD has increased dramatically over the past 3 decades across the world. The prevalence of CKD has increased by 87%. The death and disability due to CKD has increased by 98%. The burden of CKD is more in developing countries, straining their meager resources. There is a universal call for kidney health among everyone and everywhere, but the demand for service generally outpaces the resources. Despite the magnitude of problem and the economic impact, the effort to find solution are at best described feeble. For instance, the number of randomized controlled trials in nephrology registered in the US is among the lowest. Billions of dollars have been spent on kidney disease research, but no tangible progress in clinical practice. Many randomized controlled trials in nephrology have been negative, rendering the field high risk for investment with low yield. To understand why interventions fail, we need more mechanistic studies. There is underrepresentation of CKD patients in clinical trials. As shown here, nephrology is in the lowest bottom. About 57% of the cardiovascular clinical trials exclude patients with kidney disease, despite the fact CKD is a strong and independent predictor of cardiovascular disease. About 85% of clinical trials for common malignancies exclude patients with CKD. It is important to remember that non-CKD trials might not be applicable to those with CKD. Lack of data about their therapeutic efficacy and toxicity leads to suboptimal care for kidney patients. It is imperative that government and industry-funded studies should include patients with kidney disease, or they should specifically design clinical trials for CKD population. There are disproportionately fewer treatment options for kidney disease patients. In 2017, the global CKD drug market was about $3 billion, but the oncology drug market was $100 billion, 35 times higher. For each one nephrology trial, there is 39 cancer studies in the pipeline as estimated in 2019. The public demand for effective oncology treatments have driven the development of precision therapies for cancer, but nephrology community is just waking up. It is generally acknowledged that patients seen by nephrologists are highly complex and interventions often life-saving. We hear only about the mortality in dialysis, but do not hear about the mortality without dialysis. During COVID-19 pandemic, nephrologists were at the forefront and are still at the forefront, and yet we hear only about the emergency room physicians and the intensivists risking their lives. We did not hear about the heroic resilience of the kidney patients either. I guess enough for whining. The best way to predict the future is to create one. The Advancing American Health Initiative was launched in 2019 with the promise to expand options for kidney disease patients and reduce healthcare costs. It proposes three primary goals: reduce the number of patients developing end-stage renal disease, increase the number of patients receiving dialysis at home, increase the number of kidneys available for transplant. HHS Secretary Alex Azar observed decades of paying for sickness and procedures in kidney care rather than paying for health and outcomes has produced less than satisfactory outcomes at tremendous cost. In 2018, NIDDK budget was increased by about $2 billion. However, nephrology still lags behind in annual NIH expenditure for research by specialty. NIH spends about $2,500 per individual with HIV, $500 per patient with cancer, but only $30 per CKD patient. We are rediscovering nephrology through innovative collaborations and partnerships. The Kidney Health Initiative was founded in 2012 to catalyze innovations and the development of safe and effective patient-centered therapies for people living with kidney disease. One of the complementary initiatives from NIDDK is the Kidney Precision Medicine Project, fondly called as KPMP, which lays the foundation for personalized medicine. KPMP aims to create kidney tissue atlas, define disease subgroup, identify critical cells, pathways, and targets for novel therapies. Variations in ApoL1 gene is a strong risk factor for CKD and progression to end-stage renal disease. The Apollo study is designed to test whether the donor and recipient ApoL1 genotype affects transplant outcome. Nephrologists are teaming up and designing to execute multinational trials. The CAR study aims to examine whether periodic testing for coronary artery disease is needed after initial screening at time of waitlisting for kidney transplant. This, if proven correct, it will increase the access to transplant for patients. KidneyX was designed to accelerate innovations in prevention, diagnosis, and treatment of kidney disease. This collaborative project is taking major strides in redesigning dialysis and beyond. A proud moment for nephrology community is the solidarity it showed in facing the COVID-19 pandemic. All societies provided guidelines that were dynamically adapted to evolving science. Dialysis providers collaborated in an unprecedented way to isolate and minimize the risk for dialysis patients. To some, there is a large global burden of kidney disease with poor outcome. Decreased resources allotted to kidney research has led to paucity of discoveries in nephrology. Several innovative new initiatives and research studies are being launched to advance kidney health. The Global Kidney Summit offers an unique platform for dialogue among stakeholders in kidney care. The summit aims to formulate global policies to expand treatment choices for kidney patients to improve outcomes, develop approaches to safe delivery of care to kidney patients in the setting of COVID-19 pandemic, understand the cause, and to find solutions for inequalities in kidney disease, prevalence, and outcomes through global strategies. Faith is the bird that feels the light when the dawn is still dark, and I am optimistic. Thanking you.
Good morning. My name is Paul Conway. I serve as Chair of Policy and Global Affairs for the American Association of Kidney Patients. Like many of you listening, I'm a kidney patient. I've had kidney disease for 40 years, and I've gone through dialysis, and I'm 20 years out on a kidney transplant. I have the honor of serving as the co-chair of this year's annual summit with my very good friend, Dr. Dominic of George Washington University School of Medicine and Health Sciences. Over the next 2 days, you're going to hear some of the best news that we can bring you on innovations that are happening in kidney disease, in biologics, diagnostics, and devices. This is critically important at this period of time as COVID-19 and other issues are circling around the world and creating a lot of questions and a lot of angst for kidney patients. Kidney patients are among the most affected by COVID-19, and they are the patients that are out there who have a great deal of hope and optimism about change that can come. That's why this year's summit is so important, because if you're listening anywhere out there in the world, over 60 countries and thousands of patients and researchers alongside you, we want you to have hope over the next 2 days and understand that change is coming and that the things that you do in your country to help educate fellow patients and to drive policy and to create optimism and to create demand for more choices as patient consumers is critically important. We hope you take the information over the next couple of days, process it, and reach out to us at the American Association of Kidney Patients if we can be helpful to you, because we firmly believe that change is coming in kidney care, that patients are driving it, and that a mighty band of researchers and doctors and innovators are working hard to make certain that we can bring the fight to kidney diseases and to make certain that patients like us have a role at the table and that our voice is clear and that our voice is valued and that our lives matter in innovation and in the solutions that we choose to continue our lives and stay engaged in society. It's a very optimistic couple of days. We're excited about the program. We have a lot of tremendous experts. So please contact us, stay engaged, enjoy the program, and we wish you Godspeed. Thank you.